Eric, where are you located again? Are you?
And we'll go ahead and get started. Good afternoon, everyone. I'm Susie Maceda. I'm from Athens Training, and we're really glad that you're able to join us today to talk about the topic, navigating California's new COVID supplemental paid sick leave. Without further ado, or with some further ado, I will tell you, if you have questions, please go ahead and add them into the Q&A. We will do our best to answer those as we go through the presentation, but without further ado, at this point, I will introduce Jeanette Mason, our Claims Director.
Thank you. Good afternoon, everybody. Thank you for joining us today. I'm so happy to see we've got this great turnout. We've got 259 already and more coming in. So as you've all heard, Senate Bill 114, an extension of COVID supplemental sick leave, was recently signed into law by Governor Newsom. The law is somewhat similar to the sick leave provision that expired September 30th, but there are some key differences, particularly with how it's integrated and offset with other leaves, including exclusion pay. There's also some notification requirements on how you need to communicate the leave to your employees. The law is effective February 19th. It's retroactive to January 1st. So there was a lot of work to do in a short period of time. So we wanted to be able to help our clients with this new employment law, and we thought it would be beneficial to set up a training with an opportunity to get your questions and your scenarios answered. So I reached out to Eric at Sullivan and Associates and said we wanted to get this set up now, yesterday, ASAP, before the law goes into effect. And Eric was kind enough, as he always is, to accommodate us and get this scheduled for this afternoon. So thank you so much, Eric. I appreciate you. And with that, I will turn it over to you to get us started.
Well, it's my pleasure, and thank you for having us. We love doing these types of programs, especially when we have all these new laws that come out with COVID-19. And I know employers, HR and risk alike are all trying to struggle to try and figure it out. So what we've done is try and outline the most important issues that we've seen. Again, my name is Eric Dwong, managing partner for the Employment Law Department. Here with me is all around workers' comp guru and my partner in crime, Serena. And thank you for joining us also, Serena, today, because I stay in my employment law lane. And when workers' comp comes up, I shrink into the background and I say, Serena knows. So we try and stay in our lanes, but we collaborate quite a bit because there's a lot of crossover workers' comp employment law issues. So before we get started, just a few things about Michael Sullivan and Associates. We have 9 offices throughout California. We do obviously employment law, workers' comp, civil, litigation. And one of the important things I want everybody to know about is when all of this first started, when the COVID first hit the fan, back in March of 2020, we decided to put some products together for the community, free at no charge. And one of the important products is a live ebook that is available at sullivanattorneys.com. It's available for everybody. It's updated as the new laws come out. So this law that we are talking about today is going to be in the ebook. If it's not already, I think it already might have posted. And all other workers' comp or employment law COVID related laws are in there with the links and the like. So that's available to everybody. A lot of people use it as their desktop as we get new laws that come out. So feel free to use that anytime. So today we are just going to try and focus on this newest supplemental paid sick leave. As Jeanette already mentioned, this, it's not the first time around we've done this. If everybody remembers, back in December of 2020, it expired and there was no supplemental sick leave for a few months, and they decided to do this retroactive thing on us again. Hey, it's March, here's a new supplemental sick leave, retroactive to January, figure it out. They did it again to us now, so we have to figure it out with a few changes and really important changes in this new law. So what we're going to cover is who the covered employees are, covered employers, definitions of family member. That's going to be important for some of these categories. Covered reasons for leave. There's more and different caps on the types of leave and how it relates to workers' comp issues as well, because we get that question quite a bit. Requests for leave, calculating the amount of leave can be a little bit tricky. Use of unpaid leave for employers or employer provided leave, available offsets, and notice requirements. So we're going to try and get through all of that. We allotted generally 30 minutes, but I think we'll probably have a little, I'm going to go a little bit more time with the questions. So feel free to stay as long as you can. This slide, tells you what you really already know. It was signed into law February 9th, SB 114. We had seen some ideations of the law beforehand. The final version was particularly different. We were excited about a few components that might be coming out, including tax credits that didn't come to fruition, but might later. So they kind of teased us with some outlines and then didn't put all the good stuff in there at the end. So the prior law, as we know, expired September 30th. So we have this gap in time from October 1st through December, end of December, that is not covered under any of the SPSLs. All right. This new law expires on September 30th, 2022. That being said, if you have somebody who qualifies for SPSL and say they go on their leave on September 29th and they're out for 5 days, do they still get it when it runs into October? And the answer is yes, as long as it started and the qualifying reasons started on or before September 30th, 2022. And as we talked about, this is under SB 114 for those who want to take a look at it. So it applies to public and private employers with more than 25 employees. So some of the questions that come out is, for example, when there are non-employees in the workplace, for example, volunteers. And my response to that is, if these volunteers, these non-employees, are appropriately classified, then they would not count in this number of more than 25. So making sure that they're properly classified as such is important, and making that determination if you have more than 25 to make the determination. All right, covered employees, both full and part-time employees. There is no period of time for which they need to have worked in order to be part of this leave. There is a different and more complicated calculation for part-time employees. We'll talk a little bit about that. I'm not going to get too far into the weeds about calculation. You're going to have access to these slides. You'll also have access to our ebook to outline it when it does come up. So just note those resources are there for you when it comes time to break it down. Let's see, the bill, it includes firefighters, in-home supportive and waiver of personal care services are all included in the bill. There's some nuances in there for, in particular, firefighters about how you calculate the time. I don't think it's very well written. It doesn't make much sense in application, but in any event, that's how they did it. That's also available on the book. We're not going to get into too many details here with outlier specifics, but we're free to answer questions as they come up, or you can reach out to us later.
Eric, one question that's already come up is, in a school setting, what about substitute staff? Are they covered?
Substitute staff are still considered employees. So yes.
And another question came up about fire districts that have less than 25 employees, but have firefighter volunteers. If they were to include them, it would be over 25. So what do they do with that?
Volunteers technically under the code are not employees for hire. So if they are not, if they are properly classified as volunteers, they're not receiving remuneration, they're not receiving pay, they're not expecting pay, there's no expectation of that kind of relationship, then they would not be included. And it makes sense, because if the volunteer, who's not an employee, had came down with COVID, would they get the SPSL? The answer is no. So no, it's just employees, people for hire, contracted for hire would be those people that we count in this more than 25. Any others along that line?
There was a question about the specifics of the calculation for time entitlement for substitute staff.
Time entitlement for substitute staff. Well, we're going to go into the calculation for part-time employees. I'm not sure if I entirely understand the question, but when we get to calculation, if I haven't answered your question, then we can go into it a little bit deeper. Or if it's something very specific, then you can feel free to give me a call or an email after, and we can chat about it.
Thank you.
All right. So family members going to become important for some of these leaves because employees are allowed to go and care for family members. So what is that limited to? It's a very broad definition, as generally is the case in most leaves in California. So it includes biological, adopted, foster children, stepchildren, biological, adoptive, foster parent, step parent, legal guardian of an employee, the employee's spouse, registered domestic partner, spouse of a registered domestic partner, a grandparent, grandchild, or sibling. So pretty much anybody in the family unit. So if you're going to consider declining based on family status, take a look at what is included. They're probably going to fall within that. All right. This is one of the big changes for the new SPSL. And if you're going to take full advantage of it, it's going to be a little bit tricky administratively, I'll admit. But we have two divided buckets now. Before, it was just a lump 80 hours people were entitled to. And now we have two buckets of time. One is what we can call a flexible bucket where there's no documentation or proof provided. The other is a COVID positive 40 hours that we'll talk about. That's in another bucket that does require documentation. So let's talk about this first bucket of time, this flexible hours that's available to all employees without documentation. And that's the first 40 hours of leave. These are the covered reasons for that type of leave. Subject to a quarantine isolation period related to COVID-19 as defined by an order, guidance, or State Department of Public Health. The covered employee has been advised by a healthcare provider to isolate or quarantine. The uncovered employee is attending an appointment for themselves or a family member for vaccination or vaccination booster. So boosters are qualified in this new SPSL. The covered employee is experiencing symptoms or caring for a family member experiencing symptoms related to COVID-19 because of a vaccine or vaccine booster. The covered employee is experiencing symptoms of COVID-19 and seeking a medical diagnosis. Covered employee is caring for a family member who is subject to an order of guidance, and the covered employee is caring for a child whose school or place of care closed because of a COVID-19 issue. Some of these will sound familiar to you because they were many of them were in the FFCRA, if we remember that, the federal law, and the prior ideations of the SPSL with some important changes. Now, this other 40 hours, the employer may require documentation now for when an employee says, I need time because I am COVID positive or my family member is COVID positive. So we have that ability to ask for the documented proof before they are entitled to this 40 hours. So that is something you're able to do. One of the issues that comes up is administratively, especially for larger employers, how are we going to track all of this? How do we calculate and keep track of the the hours that are documented versus the hours that we don't require documentation for? I agree that's a challenge. There's many payroll companies that are really good at this kind of thing and doing coding for this type of issue. But I think this came up primarily because of worries of fraud and misuse of the SPSL that was a cry out from a lot of businesses saying people are taking this, they're saying they're COVID positive, but I don't believe them. So what has been put in here is an ability to actually require that proof for this 40 hours. Now, do you have to do that? No, but you can now take advantage of that requirement and you can deny it if they don't provide you the proof.
And by diagnostic test, there was a question, can they require a PCR test over a home test?
Yeah, so this is one of the areas that they decided to keep very unspecific. I expect this is going to come out in the FAQs, but right now there is no part of the law that requires you to use a particular type. So I think the answer is yes, as an employer, you can require a particular type of test. The trick is you must pay for the time taking the test. You must pay if they have to travel for taking the test, all those wages that go with doing that. So the dime's on you when you're having them test.
And Eric, would they also have to pay then for the time that they're quarantined waiting for that PCR test, right? Those ones usually take longer for the response.
Yeah, so that kind of actually gets into, and the way this is probably going to come up is first, an employee is going to say, hey, I tested positive. Here's my my home test. Here's the documented proof. The employer is going to say, hey, yep, we're going to send you home, but we require a PCR test. Seems like we can't ask for that. But the problem that's going to be there is now this employee is waiting for you to get the PCR test to get back. And I think the answer is that you provide them that pay during that pay for that period while you're waiting, if you're going to be very specific about this PCR test. Now, what it also allows is to cut short this quarantine time. Meaning on the 5th day, the employer can now require that the employee subject themselves to potentially a PCR test. And if it's negative, then their paid time off under Spsl is over. That'll become particularly important when they've left on a Friday, it's a long weekend, the next work day is a Tuesday, and there's still going to be a bank of Spsl available to them if by the 5th day they are negative and they can come back in. So we can require that as of these employees. Was there a question? I thought I heard somebody. All right. Okay. And feel free to ask the questions as we go throughout. I am going to hand it over to Serena because now we are talking about workers' comp, and you can take it from there.
Eric, I want to bring up some of the questions that I'm seeing on the different banks and what can be requested. On the first bank, there's questions such as whether you can, if somebody's taking leave, for example, for a child's school, can you request a note from the school? Can you also require some level of proof when it comes to the flexible bank? Can you ask them to get a doctor's note confirming they have symptoms? What kind of things, if anything, can you ask regarding that first bank, that flexible bank?
So first there's what can you request and what you can demand, right? Can you request proof on any of these? The answer is yes. Can you deny for this first flexible 40, this 40 hours if they don't provide it? The answer is no. There's no provision in there that an employer, like they can with the second bank of 40, that you can deny because they haven't given you the proof. Can you request it? Sure. If they don't give it to you, can you deny it? No.
I think that answers a lot of the questions regarding that bank.
Okay.
Okay, so I'm going to step in and give some workers' compensation interplay with this new law and how it may affect COVID cases that you have potentially already had and that may arise subsequent to this being in place in a couple days. So first, the questions that I see coming in is questions of pay. What is paid first? How is it paid? Things like that. And then also still looking at the presumption and reminding all of you the burden of proof and with the testing and the different standards. You can go on to the next slide, Eric.
Okay.
So the first question that arises, and I think it's really important to remember that this new bill did not amend any of the workers' compensation labor code. So all of that remains the same. So the first question of what is paid first, and if you recall, 321287 confirms that if an employee has paid sick leave benefits in response to COVID, those benefits shall be used and exhausted before any temporary disability or 4850 benefits. And then once that is exhausted, they then are provided the temporary disability and the 4850. So this is going to interact with workers' comp just as it did before, that the sick leave is paid first, and then there is temporary disability or 4850 benefits. So that is going to remain the same because this this labor code was not changed in any way. And there have been questions of retroactive. So what does it mean now if I've had a COVID case? January 2nd, and we didn't know about this sick leave. What do we do? Well, again, the labor code as it pertains to the workers' compensation benefits was not changed. There is some information in the bill in the labor code as to if the employer has already paid, changing the coding if it's requested. Those things are in place when it comes to the employment side. And so we don't actually have an answer from the DWC as to the specifics of what they want to see with the workers' compensation cases. For example, we have clients asking on the, like, as far as audits, we've already paid temporary disability, but really now they should have been paid the sick leave. Could TPAs ask for reimbursement and change the coding? Potentially, probably. It's not clear. Unfortunately, we just don't have an answer for you. There's nothing that's come out that's given clarity on what, for example, the audit unit might be looking for in dealing with these. We had the labor code as it pertains to workers' comp saying you shall use sick leave first. And then we have a retroactive bill that says that the codings can be moved around. So unfortunately, in the world of legislation, it's not clear.
Yeah. Did that ever come up in when this happened in March, when they had that retroactive Spsl that said, okay, it's March 15th or whatever it was, we're now retroactive to January 1st again. Did that ever come up at all?
I didn't see the questions as much as I see the questions this time. Okay. I don't know, Jeanette and Susie, if that was a big question before, but my experience is that it's a much bigger question. And I don't know if it's because this bill does add the labor codes. I don't remember the specific codes that discuss changing of the coding on the employment side.
Right.
Right. This bill does specifically discuss that. So I think that might be why it may be arising more this time around, that question.
Yeah, it's a little bit easier from the employment law side when time has been taken for sick leave or PTO or vacation, because employers simply credits back, right? That's relatively easy. Their bank is credited back to their vacation, PTO, or sick leave, and then it's allocated to Spsl. Much more difficult when a third party pays for a leave, especially when there's a disparity in the pay amount. Because remember, we have $511 a day that week for Spsl as a maximum
versus the TTD rate.
Yep.
And things like that. And of course, an employer would like to exhaust the Spsl potentially rather than paying the TTD.
Right.
So it does present a little bit of a quandary of going forward. And I think there could be a correction? Yes. What that specifically might look like, we don't have the specific answer.
Yeah, we can do for all those listening, and if this does come up, is we do have an eye on this, and we've been talking internally quite a bit about the issue. So when we get an answer, or at least a best practice, we will incorporate that into our book. And what I often do on LinkedIn is I do a blast. So if you guys don't already, if you can follow us on LinkedIn, I'm really easy to find. So Serena, and we'll put a blast out there once we know more. All right. Wait. I skipped right over you. I'm so sorry.
No worries. Just one more reminder. Yeah, no worries. The presumptions, right? Because you have now the sick leave, a bank without a positive test, and then now you have a bank with a diagnostic test that could mean various forms of testing. And so it's just a reminder that when it comes to the workers' compensation question of whether or not there's an injury, arguably there can be a compensable test without a PCR as well. You just might not be under a presumption. So we've functioned a lot based on the presumptions, but it is a reminder that you could have a COVID workers' compensation case outside of the presumption. They do exist, and they will at times be found compensable. The PCR or equivalent test deals with the presumptions. Of course, if there's a certain number of positive employees, then they are presumed to have contracted COVID at work, and then the burden shifts to the employer. Without the PCR, the burden remains with the employee. So it's just a reminder that when it comes to the interplay with workers' comp, the PCR test generally is going to be one of those things that shifts the burden to the employer.
And was anything else on that one?
Nope, that's it, unless there's any questions.
Do we have any workers' comp specific questions before I move on?
Yeah, I haven't been able to scroll through the Q&A. Susie, are you able to go through there? and
Yeah,
look?
I'm trying to keep up, and just a reminder, guys, it's a little easier. I keep putting it in the chat. It's a little easier if you put your questions in the Q&A section at the bottom of, instead of in the chat. If you put them in the Q&A, it's easier for us to track and make sure that we get your answer out to you. But there were some questions about reimbursement for PTO. And
Yep.
so I'm not really sure how, let me find that specific question.
Let me get it. I'm getting into that right now. So it's perfect timing.
Oh, okay, great.
And then if you find other questions that relate to other slides, feel free to jump in and just interrupt and ask us as we go. Happy to answer them if we can. So when do we have to give this SPSL? It's available immediately upon the employee's oral or written request technically. So what does that mean? When they've already used their PTO or healthy workplace sick leave, that minimum of 3 hours is required in California. I'm sorry, 3 days. What do? Do we automatically go back and credit it back and use SPSL? You can. Can you not do that until they make the oral or written request? You can also do that. I think administratively, it might be easier just to figure out what has been done already and try and correct the system, because so you have at least the SPSL that's running, because that's already going to be in a bank for them. So what you can do is you can wait until it's oral or written request of its use, or you can do it across the board since we're going back to January 1st. All right.
So,
Oh, go ahead.
one of the questions is, if they already used their PTO for days they are off for COVID, do we have to pay them back those PTO hours?
Okay, so the answer is, if they ask for it, either verbally or in writing, the answer is yes. Absolutely. Now, can you say, well, they didn't really ask me, so we're not going to do it? Technically, yes. I get a little concerned about that practice, because a lot of times the reality is there's a disjoint between management and HR and the people that handle these things. So somebody could easily mention it to a supervisor, which by law gives the company notice and immediately, and it never gets to HR and you never give it back. So my worry is that disconnect that sometimes happen between supervisory and HR, the people that actually do this. And if it's just an oral request, hey, I want my SPSL, that's enough right there. Does it have to go to HR? Can you require it only to HR? No, by law, it can be to any person who is under a supervisory role. So we have to just be careful with that.
So in that same regard, there was another question that said, just to clarify, for the first 40 hours, can HR ask employees to submit a form to request a leave? Yes. And it sounds like you just said yes.
Yeah, absolutely.
And that submitting that form would be considered documentation. So
yeah, so submitting a form saying I request my SPSL. Yeah, you can put that as part of your procedures. And if they don't do it, it's a violation of your procedures. But can you say, is there a defense of saying, hey, I told them I only want it in writing? You can't circumvent the law by making a policy. So can you put a policy in place saying, hey, if you want this, send this document into HR? Yes. Will that defend you if there was oral request that you never honored because there's no document? No. Hope that made sense. Any other questions on that?
I'm going to go through, there's quite a few questions, so I'm trying to go through them and okay, see what's been answered and not.
That's okay. So calculating the leave, I'm not going to get too far into the weeds. Obviously, for full-time, and a lot of this is just the same as we would for any type of sick leave in calculating it. The part-time is a little bit trickier, which might also fall into the substitute teacher question before. So because it just falls under any employee, however many hours they've worked, whether it's 3 hours a month or 10 hours a month, whatever it might be. But this is how you calculate for part-time employees. If they have a normal weekly schedule, the total number of hours the employee is normally scheduled to work over a 1 week period. If they work a variable number of hours, 7 times the average number of hours the employee worked each day for the employee in the 6 months preceding the date of the employer took the SPSL. The employee has worked fewer than 6 months, but more than 7 days, the calculation shall instead be made over the entire period the covered employee has worked. Now, so there's this 7-day mark. So if they've worked less than 7 days, say you onboarded them recently, this is the calculation for, let's see. Oh, you know what? I think, let me see. Well, apologize. There should have been another slide here. I'm not sure exactly where it went, but in any event, if it is less than 7 days, then the calculation is for that full 7 days, full period of time that they work. It's really easy, but it was another slide. I'm not sure where it disappeared to. In any event, use of unpaid or employer provided leave cannot be required to use their PTO or sick time first. So there's no, hey, you still have, those 3 days of sick time, use that first, and then we'll give you SPSL. No, can't do that. If they're eligible for exclusion pay under Cal OSHA, you can no longer use SPSL to do that. Before we were able to. This is an important change. What is exclusion pay, Eric? The Cal OSHA guidelines is a whole other topic and a whole other presentation. So I don't want to get too far in the weeds, but essentially, which I'm sure most people know out there, is when an employee comes into close contact within 6 feet with a cumulative 15 minutes over a 24-hour period of time with a COVID positive person, whether that person is an employee or not, that employee who came into close contact must be excluded if they are unvaccinated or have not been boosted, and they go home. There's a whole series of charts which are also available on our book and also on my LinkedIn. I have it posted on there as well. An easy go-to chart of how we deal with that now on exclusion. So that is what we follow under Cal OSHA and the California Department of Health. Getting back to what's exclusion pay, that person must be paid if they are excluded from the workplace and can't work telework for the period of time that they are quarantined. That now comes directly out of the employer's pocket. Do you get to calculate that towards SPSL if they've used exclusion pay already? No, you cannot. All right. There are now limitations on SPSL. We talked about this time off for vaccination for the employee or their family. It is now capped at 3 days or 24 hours unless they have verification from a doctor that those symptoms have lasted longer. So now there is a cap on this because we had a lot of businesses saying, hey, people are taking advantage of this vaccination time. They're taking a full week. We know it didn't take that long. It should be just a day. So so now we can cap it unless there is verification that it's longer.
Eric, one of the questions was whether you need a medical release to require a positive test of a family member of that employee.
A medical release. Oh, okay. So caring for a family member that's COVID positive, is that what we're talking about? Yes, that also is in the 40-hour COVID positive bucket for documentation. So if somebody says, the employee, or my family member I'm going to take care of is COVID positive, you can require documentation, and that falls under that 40 hours in that bucket. Okay. So the answer is yes.
And in that same regard, a photo of the home test, if the employer was unhappy with that, they could require a PCR, but they would have to pay for the time and for the test.
Yes, and I think as tempting as that might be, administratively, that might just make it more difficult for the employer to do. I know a lot of organizations that are doing this. There's sending out these home kits and having them test on Zoom. So you can see that they're actually the person testing on Zoom, and you get the results in 15 minutes. And then you don't have to pay for them traveling or going to a particular clinic to get these tests or paying for the test itself. That's exorbitant. So I think that's a judgment call administratively of what's better for the company. One easier, obviously, than the other. All right, calculating the SPSL rate. Non-exempt employees. In the same manner as the regular rate of pay for the work week, you do not include overtime premiums in that calculations, in the calculations and in the full pay period of the prior 90 days worked. Exempt employees, the same way we calculate their leaves when they just take any kind of sick leave. Maximum amounts. Now, I was really surprised to learn that there were a lot of organizations that were just paying whatever the employee made for those 80 hours without keeping an eye on whether they went over the caps. So there are a lot of organizations that overpaid for SPSL. Remember, it's $511 a day, $5,110 in the aggregate of the 80 hours. So keep an eye on that if you don't want to overpay on the premiums. Offsets. The amount the employer paid already, the employer received an SPSL or an SPSL-like type of program can be credited towards the employer. So what that means is there's a lot of organizations, because SPSL was over in September, that had these other programs they were putting into place. They're like, oh, this is never going to come back. You know, it's been 3 months. Let's do our own, because everybody's using their PTO and sick leave banks. They implemented that in January, and now all of a sudden we have SPSL. Can we use that separate COVID leave that the company has decided to do on their own as credit on SPSL? And the answer is yes. As long as it's separate than a regular PTO vacation, it is COVID related only for COVID related issues like the ones we've already discussed. Let's see. Let's see. I think we already mentioned that. Yep. Good. Okay. Okay. The notice. Before, as we recall, we had to have SPSL, what was available on our wage statements. It is now different, probably because we have these two different banks now. So now if for the next wage statements that go out, they should show 0 hours for SPSL if they haven't been used yet. And then the amount that is used, it slowly goes up. Somebody uses, 30 hours, next pay period, it'll say SPSL leave, line item in the wage statement, 30 hours. So you keep track of that until it is fully exhausted, until it reaches either 40 if they haven't given you the documentation, or 80 if they did. Let's see. And there is, and I just checked, I don't think they have it up yet, but the Labor Commission is supposed to have this notice that's supposed to go out to everybody. So if, obviously, if everybody's in office, post it where you normally would post all these notice requirements, in the break room or wherever all these notices are, that everybody can see. If people are remote, you should be sending it out by electronically, by email, your employee boards, wherever they would see these postings, and those should go out as soon as it's posted by the Labor Commission. I'll also probably do a posting on LinkedIn once I see that posting that needs to go out. And well, it looks like that is it for slides. So do you want to go for questions?
Oh yeah.
Great.
Oh yeah, they are active.
I love it.
Okay, so a lot of questions can be answered for wanting to know if you can require a PCR of a family member. Since they're not technically an employee, how can you guide their behavior?
Yeah, I mean, again, the code doesn't say it has to be a particular type of test, like a PCR test. Let's think about this. If you're going to require a family member to pay money to get this PCR test, especially if it's also coming out of the employee's pocket, there might be an argument there because you're requiring an extra expenditure that it comes out of the employer's pocket. It's also going to take, some time administratively to get that done. Obviously, you don't want the employee in if a family member that they're living with is COVID positive, because they're going to come back to the workforce and you're going to have a workers' comp issue, right? If they spread it around. So I think the answer is probably yes, but I don't know that you want to do that. Any others?
Oh, lots. Jeanette, can you read some of them? I'm kind of answering some of the other
Um,
I
ones.
saw there was a question on the SPSL and the 3-day waiting period for temporary disability. And I just want to remind you that when the presumptions were codified, it also confirmed that the 3-day waiting period does not apply. So we don't have a 3-day waiting period.
Yeah, sorry, Susie. I'm trying to scroll through these, but it's frozen and I can't seem to.
Oh, okay.
Scroll here. I'm trying.
So
many
some
questions.
of
Please.
these questions were answered about if they just started with us last week, are they entitled to the full leave balance? And I believe you said yes, they are. And so the other questions, to confirm if an employee is positive with documentation, they could use both banks.
Correct. For those reasons. So one of the things that's going to be administratively important if you're going to take advantage of this is whoever is handling it has to be really good at documenting the reasons the person's taking it for, right? So it's really important that whoever's doing this is well organized, and this is to, care for their grandparent that they're living with. This is this is because of a home seclusion order, whatever it might be. So you know which banks we're talking about. But can they be taken out of order? And it's, they've just become COVID positive. And now we're working on that separate COVID positive bank. Yes, that can come first or in the middle, and you can have it in increments until you reach the maximum.
There's a question. Can you please explain the pay stub requirement again?
Sure. So with the last supplemental paid sick leave, we had to have a line item that showed what was left for supplemental sick pay, whether it was, you have 35 hours left because you've used, most of your 80 hours. Now, because we have two banks, now we start from zero. So if nobody has used it, nobody in your company's used it, everybody in the next wage statement shows SPSL 0 hours because 0 hours have been used. And then when somebody actually uses it, whatever hours they use, it'll show in the next pay stub used 25 hours, whatever it might be. So now we're tracking up until we get to 80 with that. Hope that answered the question.
With respect to the 3 days, 24-hour limit for obtaining a vaccine, as I understand, this includes appointments and recovery. Do we automatically approve 3 days for every appointment? Or can we limit the time to actual appointment and require that they call in afterwards if they're experiencing symptoms?
You can do that. Yeah. I think it becomes an administrative question. Now, can you deny somebody who says, obviously we can't require proof for the 3 days, 24 hours that they're experiencing symptoms, only proof if they try and go beyond that. So I would probably just give them the appointment time because it's part of their bank, their 3 days, 24 hours, and let them come back to you if they have symptoms or need to take more time off. It's upon their request. So you don't have to say, hey, you got 3 days off, you're going to go get your booster. You don't need to do that. I would wait to see if they need and make it available to them if they ask for it. Otherwise, you might just be giving people 3 days off without them needing it.
Another topic that came up is if we're waiting for people to test negative before allowing them to come back to work, I guess there's some thoughts that you might be positive for an extended time.
Right. So let's be clear on a really important point here. We cannot generally require a negative test for an employee to come back after the 10 days. Remember, it's a 10-day quarantine period under Cal OSHA. And coming back after those 10 days, you ask those questions. Have you had a fever within the last 24 hours without fever-reducing medications? Are your symptoms improved, et cetera? If they answer those questions correctly, because a person who's COVID positive could be positive for a very long time and still be asymptomatic and not contagious. That's the reason we have those questions. Now, where we get into negative tests is getting people back earlier. because that was a big question. Nobody needed the whole 10 days. They can come back after 5 days if they test negative. So now we have an option with the new Cal OSHA amendments that were in January, that if they test on the 5th day and they were COVID positive and they are negative, then they can come back early. That being said, if they refuse to get tested, which they can on that 5th day, you can't force that. But if they refuse it, or if they don't test for whatever reason, then it's the full 10 days. And you cannot require a negative test to come back after that 10th day. It's those particular questions under Cal OSHA to get them back into the workplace.
We have quite a few outstanding questions. There are 85 in the Q&A.
Oh, wow.
And there are a lot more that are being placed in the chat that are kind of hard to track. So again, if you could kindly type your questions instead of in the chat where we said hello and hi and talked about romper room, if you could put them in the Q&A section, it kind of helps us being able to track them.
I see a
So
question on SPSL and workers' compensation pay, and the question arose if you have them using the SPSL for their COVID positive, and then later they need to care for a child, and the employee argues that they should have been paid workers' comp when they were positive. It's just a reminder that the labor code says you shall use SPSL first before TTD. So the employer is doing nothing wrong when they are positive and not paying TTD. They are to use the SPSL first. So yes, could theoretically they have exhausted it when their child's school closes or is symptomatic? Potentially, but the employer has done nothing wrong in that situation.
Yep. Fantastic. We're at 1:47. Do we want to stay? We've already gone 17 minutes over. I just worry about people's time frames out there. I want to be respectful. I'm happy to stick around for more questions. Also, here's our info, and you're absolutely free to reach out to us or Jeanette and Susie if you want to go and get those answers. We can try and do that as well.
one of the things, what I'll remind you is that if you would like a copy of the presentation, a copy of the recording, please email training@athensadmin.com and I will be able to respond to you there. Again, email your request to training@athensadmin.com so that I can respond to your request and provide you with the materials that you requested. One other person was asking if you have a suggested form that you would use to request the SPSL.
I don't have, it's not in any of the templates. I don't have a particular form. I'm not sure what that sound was, but I don't have one. And for the most part, it's because of the oral request that I get concerned about. I don't want it to be a belief that we can have this form out there. If they don't fill it out, then we don't have to give it to them.
Right.
Sorry about that background conference call. I have no idea where that's coming from.
Okay. And so to that point, there were some questions again in the chat asking about that the employees need to request it, but it sounds like they need to request it either verbally or in writing. And you said previously that it has to be just raised to anybody in the supervisory capacity.
Yes.
So, and you could put it in your workflow. That is something that you would like it to be in writing, but even if it's verbally requested, it needs to be extended.
Yeah.
And do you know if they're planning on having frequently asked questions or any clarification on this sick leave that'll be posted soon?
Yeah, I do. Sorry, I finally got rid of that sound. Yes, like what happened with the last
Right.
SPSL, it was all a nightmare. They cobble these things together, they throw it on the wall and they expect us to figure it out. And it's usually a long time before they actually get back to us with FAQs. So I'm going to keep an eye on the FAQs as they come out. There's nothing new yet that's answering any of these particular questions that we don't have, a full and complete answer, like the type of test and can we mandate it? That's kind of left out there in the ether. As that comes out, I will also do a LinkedIn posting so everybody has access to it and knows that there's new FAQs. But I wouldn't expect that quickly because they run at a snail's pace. So yeah, eventually.
Okay. And are there timeframes that you can remind everybody of for when they need to start providing this pay upon request?
So February 19th is the technical date, but we should start it right now. So since it's retroactive to January 1st, right? It's already covering any time from January 1st to now. So there's no reason if somebody asked for it today, even though we're on the 17th, I would give it to them.
Yeah, I'm sorry I couldn't get to more questions. It's been frozen for me for some reason this whole time, but we can definitely take a look at them and maybe get them to you, and we can get back to people in the future with a response.
Sure, we're happy to do that. As
Reach out.
Please reach out to us.
There are some questions, and you guys feel free. The other thing is Athens employees, if you attended this, I will be submitting your attendance to continuing education. So you do not need to email the certificate you received into continuing education. They will be aware of your attendance. If you guys want to hang on the line, I can continue to bring some questions forward, but if you have to leave, that's fine as well. What is recommended if someone is paid TTD and now wants retro Spsl?
That's a good question. So there's nothing that has come out on clarifying on what that's supposed to look like. I do think it's probably something where a TPA may get reimbursed and there might be a change of coding on the employer side. But we don't have anything that has come out from the DWC of what they're expecting to happen.
There's some questions about, a lot of questions about firefighters. Is there a different calculation for the wage for firefighters?
Yes. Short answer is yes. And I don't have it particularly memorized at the moment. It's in the ebook, but what essentially is in there that is a little unusual and confounding is that the measure of time for the firefighter is based on the previous week before they asked for the SPSL for some reason. Which, firefighters have varying times of work and overtime. So it doesn't necessarily make sense that we're using the preceding week for that, but that is the use of the calculation for firefighters is we're looking back 1 week of what their schedule was in calculating what they're entitled to. So I expect that we're probably going to get some FAQs on that because it seems a little cobbled together to me. But if you want a full, outline of it, it is in the ebook on Sullivan Attorneys, and it's also linked on my LinkedIn as well.
A question about the ebook. Do you have to create a login?
Nope.
Like create a password or anything?
Nope.
Okay.
Go to sullivanattorneys.com. As you scroll down through the menu at the very bottom, you'll see Navigating COVID-19, which is the title of the book. And there's also a tab in there that says COVID-19 resources.
There's a couple questions coming up again with the interplay with workers' comp. There's a question on if an employee is eligible for 4850 and if their earnings are more than the $511 per day, would they pay the partial? And the answer is yes, because you've then paying the SPSL and then you pay the additional or differential payments that would be due to that individual. And there's a question of whether all 80 hours of SPSL needed to be exhausted before TDD starts. Yes, if they're eligible for all 80, you would use all 80 and then start the temporary disability benefits.
If it were them that was injured.
Say that again. Yes, right? Because theoretically, if it's the employee that's positive, they are eligible for the full 80, both banks. And of course, you'd have to ensure that all the proper documentation, all of that they actually do qualify for the 80 hours. But if they do, then yes, you would exhaust that first.
And the leave can be taken in hours, not days, as opposed to, there was, I think, the question that I did see was that can you take it in days or hours?
Hours.
It's hours. And that's where sometimes it does get complicated, the interplay with workers' comp and the differential, because I have had cases where it can get complicated in the calculation, but yes.
Yeah, so technically somebody can take 3 hours one day, 4 hours another, 5 hours another. So it's not just because they're out for part of the day doesn't mean we calculate a full day's use of SPSL.
What would you suggest if HR cannot set up this leave until the system until March?
Well, well, technically, if February 19th is the deadline to get all of our ducks in a row to be set up. So I certainly wouldn't be denying people the leave. And I would be very cautious about making people use their PTO or especially the healthy workplace sick leave type leaves until you get it all together, especially if it's any kind of detriment to them, and or if they're basically they're saying, hey, I've exhausted my leave while you're trying to figure this out. I would still do my best to try and honor requests and try and figure that out. And hopefully you don't have a lot of them because the numbers are declining. But that would be my recommendation. Technically, not doing it until March would be it. And there were requests that weren't honored is technically a violation.
So is there a time frame by which you have to turn around any kind of payment that's
Within
brought
the pay period.
forward?
Within the pay period, it was requested.
Okay. And again, there's just a lot of questions about if the employees don't request the SPSL, are we still obligated to offer them this benefit?
So technically, that is the way it's written. Upon request, written or oral by the employee. So technically, you can do it that way. Of course, we have to send out this notice to everybody. So everybody gets this notice, everybody gets this flyer, they're aware that it's available to them. If you're going to be strict that way and that they have to have made the oral or written request, make sure that those documents are provided to everybody. So they don't have an excuse saying, hey, I never knew that I had this. I never knew I had the right to request it. They never gave it to me. Or they posted it on in the kitchen and I haven't been to the office in 2 years. I work remote. So I just be careful with that.
So part-time variable employees, you said it's by hour, right? That if you're calculating their wage rate, it's if they only, I'm sorry, here's the question. I'll answer it. I'll ask it in its entirety.
Okay.
If question about the calculation for subs, since they are part-time variable employees, is it total hours divided by total days times 7?
There we go. Let's see. There it is right here. So this is how it depends on how many days they work. And if it's more or less than 7 days and how far you look back depends on the time frame that they've worked. This is the calculation right here in front of you. It's a little bit tricky. So take a look at it. This will be available to you as well, but I'm pretty certain that substitute employee teachers are going to fall specifically within this. All righty. Well, as there are other questions, again, feel free to reach out to us. If we, you can either reach out to us directly or through Jeanette and Susie. And it's been really an honor to do this for all of you. And thank you for giving the time. And I'm sorry for those who had more time here than they expected. Hopefully it was useful for you and not a waste of your afternoon. So we appreciate you.
Yeah, thank you, Eric. Thank you, Serena. I really appreciate you both. It's we had a lot of questions because it's all new and you're helping us out. We really appreciate your time today.
I'm sure there's more, so please reach out as the questions arise and you're dealing with this.
Thank you guys so much. You guys have a fantastic day.
Great, thank you.
Thank you.
Thank you, everybody.
Take care, everybody.
Bye-bye.
Oh, it just unfroze. I think I needed, Once it dropped to under 100 people, my Q&A worked.
There's quite a few questions in there, so we'll do our best to get some of these responded to and
thank
get
you.
answers out.
I appreciate
to
that.
a lot of requests for the material, so I'm hoping that I'm going to have a flood of people requesting those in my inbox at training@athensadmin.com so that I can get those out to
That over
everyone.
stuff. Absolutely. Thank you again for spearheading this for us and
No
for
problem.
getting to those Q&As for me.
As best I
appreciate it.
could, but man, there's like 112 in the Q&A
Yeah.
and
The record.
quite a few in the chat. I had a feeling because it is, a tricky topic, so it's not
is.
unusual, and everybody's circumstances are not quite exactly what is as
Right.
easy digestible, and that's why they're here, right? Is because if they could read the bill and read the act and read the
Right.
materials and understand it would be simple, right? But we know it's a complicated topic, and that's why we held this webinar.
Yeah,
So
exactly.
let's see. We still have 45 people on, so I'm going to go ahead and end. And thank you guys again for attending. Have a
Thank
good
you.
day.
Thank you.
Bye.
Bye.